Diabetes in itself is probably a very good example as health at large, because it's an increasing problem, particularly type 2 and gestational diabetes. And just increasing money directed towards it really isn't the answer. It needs to be money well spent in a department that has some sort of direction towards it. So it would be an evolving process. However, I think there's three main things that one could do within a unit such as ours to direct care and be the leading care provider and institution for diabetes in pregnancy. I think the first is, as I said, a very collaborative team approach. There's many voices that need to be heard, particularly in a field like this. As we said, there are diabetes educators who are at the coalface and sort of the front of house staff for people with diabetes. There's endocrinologists who are the real academics and understand the physiology behind the disease and some of the medical properties that are important. And then there are obstetricians who have a bit of an encompassing role, including managing the pregnancy and the baby and the delivery. So it's bringing together all those voices and competing needs to find an appropriate narrative to what is most important and where attention and therefore money is best directed. And it really sort of can't be done by an individual. It has to be done with a team consultation. So I think that's probably the first thing and the most important, and probably something that health in general could learn from. The second is high quality prospective research. And again, in a unit like this, where there's huge numbers that come through, where the biggest standalone maternity centre in Australia and therefore have the biggest number of diabetics come through as well, that producing research prospectively as things come in is really important to, again, direct where the needs are and where attention really needs to go. Gestational diabetes in Australia underwent a transformation last year in 2015, whereby a World Health Organization directive was adopted to make the inclusion criteria for those with gestational diabetes a lot more strict. That's been estimated to put up the number of diagnoses in Australia by over 35%. So there's obviously, it's a classic field whereby there's a sudden increase in the numbers and the diagnoses coming through, and a sudden workforce need and a sudden financial need in terms of servicing that. So prospective research then is really important to determine if that need is being met, but also if the way it's being diagnosed is appropriate, and if all those increasing numbers coming through are truly at risk and truly needing of all those extra services as well. And that's a really important point, I think, to take out of a service such as ours. And I think the third thing is retrospective research. So something whereby the unit has very good quality control and audit within, whereby it's presented to the members of the team in terms of the outcomes that are being achieved and the outcomes that we're wanting to be achieved, and that everyone has a chance to feed back into that and work out if that's where the benchmark was set or below or above, and how things can be improved. So I think the sort of three main things I'd like to get at initially are the collaborative approach with the very diverse team, instigating some prospective research to really address this really prevalent problem, and whether the huge increase in need is really there, which I think it probably will bear out to be, and also instigating some retrospective audit and quality control to make sure that what's happening within the unit is reflective of what the wishes are.